you, Travis, and welcome to tonight's edition of the Regional News. We start off with some good news where the government of the United Kingdom has provided £5 million to the Caribbean to help contain the spread of COVID-19 in the region. A release from the British High Commission on Thursday stated that the funds will be split by way of £3 million to the Pan-American Health Organization PAHO for the provision of essential medical supplies and management support, and £2 million to scale up assistance for the most vulnerable households and to counter domestic violence against women and children. And I quote, "The UK government is committed to supporting our Caribbean friends and partners through this crisis. We all face unprecedented challenges with COVID-19, and UK assistance is supporting vulnerable health systems in the Caribbean and across the world to save lives, protect vital services, and reduce the risk of future waves of infection globally," end of quote, UK Minister of Caribbean Baroness Sugg said. And I quote, "In addition to our multi-million funding to UN agencies and to the WHO that benefits the Caribbean, this direct regional support will help Caribbean countries to cope with the coronavirus crisis, mitigate the wider social and economic impacts, and protect the most vulnerable. The UK stands with you in these times of difficulties," end of quote. Meanwhile, the UK is also reallocating resources from its £400 million development program to help tackle the crisis and support countries that are most at risk. This will see support being provided to the Caribbean Disaster Emergency Management Agency, CDEMA, Regional Response Mechanism. It includes COVID-19 modeling and surveillance products for participating states being developed by the University of West Indies through the George Allen Chronic Disease Research Centre. Altogether, the UK has provided £744 million to support global efforts to stop the spread of coronavirus, find a vaccine, and save lives around the world. And now in Trinidad and Tobago. The island nationals stuck in Guyana and Venezuela have been given the green light by National Security Minister Stuart Young to return home. However, Young said on Friday, as was done with nationals who returned from Barbados and Suriname, they will have to make their own flight arrangements as the government will not incur the cost for their return. Speaking during the daily virtual COVID-19 news briefing, Young disclosed that exemptions have been given to allow the return of some 23 nationals who were working in Guyana and an undisclosed number of Venezuelan nationals in Venezuela and in Margarita. He said there were over 3,000 citizens all over the world, and the government has received many requests for permission to return. Last month, 33 nationals in Barbados returned to Trinidad after chartering a flight for $25,000. And finally, in Jamaica, the Health and Wellness Ministry is reporting 5 additional COVID-19 cases in Jamaica, pushing the tally to 478. Portfolio Minister Dr. Christopher Tufton indicated that one of the new cases is an 18-year-old male from St. Mary who is a contact of a previously confirmed patient. The others are 3 men who range in ages from 18 to 69 years and a 17-year-old female. 35 imported cases, 171 cases that are contacts of a confirmed case, 11 are local transmission cases, and 257 are under investigation, 221 of those linked to the workplace cluster, and 36 others. 4 are to be classified. The age range for the confirmed cases continues to be 2 months to 87 years. 8 more persons have recovered from COVID-19, bringing the total to 57. So far, 6,095 samples have been tested and 5 new positive cases for today. Of the 6,095 persons, in addition to the 478 that have returned positive results, 5,576 are negative and 41 are pending. In the last 24 hours, 102 new samples were tested. Tufton stated that with the testing backlog out of the way, the ministry, in collaboration with the regional health authorities, will explore expanded testing options for COVID-19 to include the testing of all admissions to hospitals and the creation of an appointment system for persons who wish to be tested for the coronavirus. And that's it for Regional News this evening, and I continue to urge our viewers to continue washing those hands, continue to practice social distancing, and wear those masks. Back to you, Travis.